Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Well, welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama of, by this point, probably 4.
He will be here.
He will be here very soon. And our co-host.
I'm Anna Kate, your medical mystery overachiever and discovery liaison. And again, we have another gorgeous face with us today. So if you're watching us on YouTube, go look at this beautiful face. Can you introduce this lovely lady to us?
Yes. This is Dr. Samira Jafari. She is a doctor of dental medicine and someone that I refer a bunch of patients to because I just love and trust her care with my patients specifically. But she's the owner of Integrative Family Dentistry and an expert in all things kind of tethered oral tissues. So we are so excited to continue our month of kind of newborn and baby care and have you on board. Dr. Jafari, it's so good to have you.
Thank you both so much. And Cece, vice versa, I trust you fully with all the kiddos that I see that have all these inflammatory issues. So I know you see a bunch of my kiddos as well.
Yes, it goes both ways, that's for sure. Can you tell our community just kind of who you are? How did you get to where you practice now? What was your journey into kind of the more integrative dentistry world?
Absolutely. So I am a general dentist and a mom to 3 little kiddos. I graduated dental school in 2013. And soon after I graduated, I was fortunate enough to partake in a CE course that was about airway development in kids. And it rocked my world. Like it was things I had never heard before in my 4 years of dental school, 4 years of college, and and before that. So it was really intriguing how, with all this education in this area of the mouth, I had not heard anything about airway development in my studies. So it opened a door for me to learn more. And as I learned more, I found that um, it really is a field of dentistry that is not explored as much, and there's not that many people that are trained in this field, and there is so much need. Like we are either ourselves affected or have kids that are affected by some of these symptoms and things that we'll discuss, and it really felt like a calling for me to pursue this more, because I felt like I could make the biggest change as a dentist, not just like in the short term, but for some of these kids for the rest of their lives. So it really spoke to me. Over the past 10 years, I've tried to learn as much as I can. Um, it's actually a really exciting time to be in this field because there's a lot of new research coming out supporting the things that we've been doing. So it's really exciting to be here, and I'm trying to learn as much as I can. I still feel like there's so much more to learn. So, and as far as like, this has led me to learning more about like the body as a whole, the airway side of things, and also being a mom and kind of like starting my career in the more conventional side of things and kind of seeing the limitations there has really helped me to kind of like come more into, the functional side of things. So I'm excited to have a practice where I can, kind of like do both sides, both with the dentistry, making sure I'm, finding the more biocompatible materials for my patients, but also being able to help like the kiddos with like and babies with their airway development and things like that. Um, so that's been, the past 10 years of my career. And with my own little ones, we have gone through the journey and I've seen the
Mhm.
changes in them. So um, I have firsthand experience of how all of this goes. And it's exciting to be able to share with patients that I've been through the same process, especially with like newborns. My little one is over a year old. And we went through this whole like tongue tie journey with her, and we documented the whole thing because it was an emotional journey and a difficult journey. And documented the whole thing. It's on our Instagram page um, if your listeners are interested in looking at what a newborn journey for a release provider's baby is like.
Amazing. Well, I'm so excited to have you on because it's airway is, I think, a topic that's not educated enough on, and a lot of parents don't understand the importance of the airway. Then a lot of adults don't understand the importance of the airway. So I'm excited to kind of tackle both worlds here with you. We'll start with more on the newborn side of things and kind of gradually work through and progress through the life and kind of what airway means to each individual essentially and how it can impact us if there's anything going on. So starting kind of preparing for birth or preparing if a mama's having a baby, or if they've already had a baby and we're talking about breastfeeding and latching, where can we educate mamas a little bit more so ahead of time in terms of what to look for? Because what I find is a lot of times babies are born and no ties are assessed, or they are assessed and missed. And then I don't see the baby until a month later. And now the mom's been struggling for a month with issues with latching, and it hurts, it's painful. The baby's gulping, milk is dripping down the side of the face, and nobody has assessed the baby. So, what are some tips that pregnant mamas or new moms can look for if they're having a hard time breastfeeding or if it's painful?
I have a question.
Mhm.
Can you explain what an oral tie is?
Ah, that's a good place to
Let's start
start.
there.
Absolutely. Yes, absolutely. So, let's start with like just go over like basic definition of what tethered oral tissues are. So, we all have a piece of connective tissue that connects our certain parts of our oral structures to another structure. So, for example, we have a piece of tissue that's connecting our tongue to the floor of the mouth, and or a connective tissue underneath the lip, from the lip to the upper gum. These tissues are called frenulum or frenum. Plural would be frenula or frena. Now, when these connective tissues are too thick or too tight, or not allowing proper function of those muscles, we say that they are tied, or they're tethered oral tissues, and the individual would benefit from the release of these tissues to allow full range of motion of those structures. So that's what a lip tie or a tongue tie is a restricted oral connective tissue. So does that answer your question?
It does.
Yes, not mine.
Yes. Now you have to answer Cece's question. We have to start with the basics
Yes.
here.
So absolutely love it. So as far as Breastfeeding is always portrayed as this natural thing that, our babies are born, and it's always portrayed as this beautiful, like natural process of life. But what I find is that in most cases, it's not just as easy as, baby's born and they latch beautifully and there's no symptoms. So I think normalizing that it's, it's something that takes time and effort, and there could be a difficult challenge. There could be challenges along the way, um, so that we are setting our expectations correct, and are prepared to tackle those challenges. I think some of the best things that a pregnant mama can do is to get ourselves educated, to know what things to look for, uh, um, but also um, there's a lot that goes with setting up your care team, right? So you want to make sure to find a really uh, uh, savvy or tongue tie savvy or tethered oral tissue savvy lactation consultant, so someone that has information on what symptoms to look for, and are able to see when a baby's latching, what's in what areas of function they're deficit. So having that provider set up beforehand, and even having your initial consultation with that lactation consultant before the birth of your baby would be very beneficial, because you already have that system set up, and within the first few days of life, you're able to get your baby evaluated, both for the way they're latching and the way they're functioning, but also to see if if your baby is actually able to transfer milk. So there's been a couple of cases where I've had mamas that came in with their baby who latched on beautifully. The lactation consultant at the hospital said, "Oh my gosh, this is a beautiful latch. They're staying on for hours. They're feeding all day. It looks really good." But then a week later, when they were dismissed and they went home, they had to go back to the hospital, and the baby had to be placed on IVs because they were really dehydrated. Because even though they looked like they were breastfeeding, they weren't actually intaking milk. So now they were dehydrated. So a lactation consultant can do a weighted feed, meaning that they weigh your baby with specific scales before and after a feed to make sure that they're actually transferring milk.
Mhm.
Um, as far as lactation side, like specific lactation aside, body work is also a really big, has a lot of benefits to both the baby that's inside uh, uh, the womb, but also the mom. So things like chiropractic care, craniosacral therapy, craniosacrofacial therapy, Arvigo-Mayan massage, things like that, to both control our anxiety and stress around the end of pregnancy, and anticipating this birth, but also they can help position baby a little bit more naturally for a easier birth, less traumatic birth, so that baby also doesn't go through a lot of stress, which can affect them post delivery with latching and things like that. Um, Also, just like managing stress. We all know, as third trimester mamas, we don't get much sleep, which can contribute. to more stress and your body just being more in a stress state. So anything to alleviate that can also um, reduce that cortisol for the baby, which gets them in a more comfortable and balanced environment so that they are born with less stress.
Mm-hmm.
Um, so I'm trying to think what else. Obviously, like nutrition and all of that kind of goes hand in hand with all of this. So even though the baby is inside our uterus, there's a lot that we can do to prepare for that birth,
Mm-hmm.
to help things go smoother after birth.
Yeah. Can you talk a little bit about what the different, you touched on tongue tie, lip tie. One, are those the most common ties that you see? And two, what symptoms, if when babies hear, what symptoms could moms or
Mm,
parents see if there are certain ties? So, specific symptoms for a tongue tie, for a lip tie, for the buccals, and what are the most common ones that you do see
mhm.
currently?
Yeah, so the lip and tongue ties are definitely the most common ones that we see. I always check for buccal ties as well. Those are cheek ties. Those are connective tissue from the cheek to the upper gums. And sometimes those are also connected too far down and they're so tight that don't allow good function of the cheeks. The lip tie and buccal ties are part of the facial fascial system, which can impact the way the TMJ is functioning. And if a baby is holding their jaw really tight, they're not able to open wide for a good wide latch. So lip ties can also impact if the lip is not able to flange up over the nose. Baby's not able to elevate the lip to be able to uh, flange, so they um, uh, use a less deep latch and use more of their lip for functioning. So they end
Mm-hmm.
up getting like little blisters along the lips because they're using their lips too much. Because they're not able to flange out and relax the cheeks and lips. Um, and other things that we see is that a lip tie can also contribute to the mouth staying open, which in turn can impact the way the lips come together. As they age, it can cause a more open mouth posture. Um, with tongue ties, and I think tongue ties are um, uh, they're the ones with the most amount of symptoms. And when the tongue is not able to move freely, um, there's a lot of symptoms that are associated with that. Now, traditionally, we looked for a tongue tie based on how far a tongue could stick out of the mouth. So, and unfortunately, still to this day, a lot of providers are looking at it that way. So they ask you to stick your tongue out as long as your tongue is coming past your lips like that, then you're not tongue tied. But a lot of times, and if you think about it, with tongue ties or with our tongue function, nowhere in our function do we need to stick our tongue out. And it's more about lift of the tongue and elevation of the back of the tongue to the roof of the mouth, where most of the function of the tongue comes. So that's what we check now is how well can the tongue lift up. We're also looking at the extension or how far the tongue can come out, but more how much the back of the tongue is lifting. Some of the symptoms that we see in moms and babies. So you can look for symptoms in yourself. So like if you have um, difficulty with, if you have a lot of pain with breastfeeding, is a sign. If your nipples look different, so they typically like get this like blanched flattened look after a feeding, that's a sign that your baby is um, not functioning properly at the breast. If you have a lot of nipple pain and damage, so I get moms that have like literally bleeding nipples because they're so dedicated to feeding their baby that as moms we go through a lot, and we always, like almost always, put ourselves last. But I see a lot of damage to nipples because the baby is chomping or not feeding properly at the breast. Also, blocked ducts and mastitis. If your baby is not able to feed correct at the breast, they're also not able to drain well, so that we get backup of milk, and that leads to blocked ducts and mastitis. Um, Also, if you have decreasing milk supply, so I have baby moms that have no symptoms, like they there's no pain, the nipples are not damaged, they're not having any like discomfort while feeding, but then we see the clogged ducts or decreasing milk supply, and that's because the baby is just not strong enough to feed at the breast. So they basically just like stimulate that let down, and once the
Mhm.
letdown is done, they're just kind of like sitting there and swallowing, but not really like functioning at the breast. So if you're not having pain, that's also not a sign that your baby is not tied. So it could just be that they're not strong enough to cause pain.
Right.
um, with the baby, a lot of times we see a lot of like a lot of fussiness and gassiness, a lot of reflux symptoms, a shallow latch, noisy feeding, leaking from the corners of the mouth, poor weight gains in some instances. It's not all the time. So a lot of pediatricians put a lot of weight on weight gain. And if the
Mhm.
baby's gaining weight, as long as the baby's gaining weight, everything is fine. Um, and they're not looking at like all the other symptoms and the ways that baby could be more efficient and the mom more comfortable.
Right.
Um, Also, we're looking at like noisy breathing, mouth breathing, lip blisters, as we discussed, coughing and gagging when they're let down, they're not being able to manage the let down and things like that, are all signs that there may be restrictions in the way that may be causing your baby not to be able to be as efficient.
Right. And all of that also, minus the pain, applies to if babies are just bottle fed. So I think that last part is really important for parents who go right to bottle feeding, whether that's pumping breast milk or formula, where the baby can still have those symptoms of being more colicky, being fussy, more gas, the milk dripping down the side, gulping, clicking, weight gain issues, etc. All that does not just apply to breastfeeding mamas, but also to bottle feeding too. So thank you. Those are really, really good signs I think that parents can watch out for, because I do find that it's so often missed. The other part is some parents, if let's say that I do find a tie in an oral tie, and I say, hey, it would be great to, go see X, Y, and Z to have this evaluated. Some parents will decline to do so, and that's their free choice, absolutely. But can you talk a little bit about what, if not correct, if parents decide to not correct those ties now, what implications can that have for baby in the future in terms of, maybe when they're 8, 9, 10 years old?
Absolutely. And I hear that all the time. So even like patients that come in for consultations, they are hesitant because it is surgery. And we always put surgery as last resort. Um, but things that I talk to patients about is, I always try to base my decision based on the symptoms that are happening now. So I don't want to treat based on what may come, right? Because I don't have a crystal ball. I don't know what kind of symptoms they will have for sure. But there are a lot of different symptoms that are connected with tethered oral tissues that I'm going to review, and give this information to parents, and they can make their choice and their decision. But just like you said, so a lot of moms say, like, is this my foolishness or my selfishness wanting to breastfeed? Should I just start bottle feeding so that I don't have to do the surgery? And I'm happy that you brought that up, that these symptoms don't go away. Now, bottle feeding is a lot more lenient when it comes to oral function. They don't have to be functioning as well to be able to bottle feed. It's easier for babies to bottle feed than breastfeed for sure. Um, so if you were to switch to bottle feeding, um, just to get through that infant period, you may be able to get through that infant period. But if you're not looking at that oral function and correcting that from the beginning, it's not something that's gonna self-correct, and it
Mhm.
gets worse. And as oral function gets worse, then we see other things come up. For example, typically with babies that we don't do a release as an early on, and they switch to bottle feeding, then I may see them back when they're transitioning to solids, because now they cannot tolerate any solids in their mouth. They can't move food around. They can't swallow. They are gagging and choking on solids. So that's around like 8, 9 to a year, where when I see them back with feeding challenges. Now, with suck and swallow is a reflex that we are born with.
Mhm.
So all babies are supposed to be born with a suck reflex, which is to help us be able to feed at the breast or bottle. Now, that suck reflex is integrates or leaves around 2.5 to 3 months of life, typically. And with uh, swallowing solids, that's actually a learned behavior. So it's something that we have to practice and learn. And the suck reflex is to help us gain the function and gain the strength to then be able to manipulate food around our mouth. But what happens is, what we see is feeding could be going well, or baby could be sucking well the first 2.5, 3 months of life. But then when that suck reflex starts integrating, function tends to take um, a downward path, because the
Mhm.
baby starts compensating for their lack of movement.
Yeah.
So, but our bodies are so smart, and we're looking for the path of least resistance. So we learn to compensate really well. So if your tongue can't move as freely on its own, we start using more of our jaw so our tongue can go with it. But we're not really like moving the tongue itself. So we end up building a lot of tension through here, because all these muscles are overacting. Um,
Mhm.
but still, when it comes to solids, if you're not able to move your tongue side to side because you've learned to compensate and not really move your tongue, then you can't manipulate bolus, the food around your mouth, and you're not able to swallow as easily. So that's one of the things that we see. Then, if we pass this stage, then there's always speech development. And we
Mhm.
see a big correlation with like speech development and tongue ties. If we pass all of these, then we have growth and development issues. So the tongue plays a huge role in the growth of our upper jaw, and in turn, the entire upper face. So the
Mhm.
lower jaw and upper jaw are two separate structures, and they're actually made up of different bones, um, different types of bones. the upper jaw is the same bone as your cranium. It's a type of, it's called cancellous bone, and the way cancellous bone grows is by light force. So, for example, like your head grows to the size of your brain, right? So if the soft, mushy brain as it's growing on the inside is putting pressure on the bone of the cranium, and our uh, cranium grows to be the exact size of our brain, right? It's like a perfect fit. It's the same thing for the upper jaw, with the tongue resting and pushing against the roof of the mouth. The upper jaw grows to where it's supposed to, wide and forward. So then we have enough room for our teeth that are going to come in. But also, we are helping to develop the nasal floor because it's the same bone. If you go through the roof of your mouth, you end up in your nose. So as the upper jaw is more narrow and deep, so is the floor of the nose, and it can impact the way we're breathing throughout our lifespan. So we want to establish the tongue resting in the roof of the mouth from infancy. So that's definitely one thing that new mamas can look for is when your baby's sleeping, just to put a little bit of pressure on the lower chin to see where the tongue is resting. So you're gonna push down on the chin and look to see where the tongue is. If the tongue's resting low in the mouth, that's not a good sign. If the tongue's resting in the roof of the mouth, that's a good sign, and we want to encourage that, and we want to always check for that and make sure that they have their tongue resting in the roof of the mouth as they're growing and developing.
Another question that I get quite a bit kind of on this subject is parents when some of these ties are identified so early on, they're scared and they're like, "Well, do I have to go get it corrected right now? Is it better to go get it corrected right now?" And my deferral is always to you, right? I'm like, go have that consult and she's a professional, she'll help you navigate that. But if patients are, talk to us a little bit about that. Is there a too early mark to have babies corrected? Is it fully dependent on symptoms? When do we start with more physical therapy, like exercises versus jumping right to the corrections?
Great question. So, um, I don't know if there are any studies on like timing, right? Like, is it too early to do the release when a baby is like a day old? Um, as a general, like what I have found is, um, it depends. So there are babies that are tied to the tip of the tongue, so their tongue is has like no movement at all. There's like the very short frenulum, and it's impacting the way they're able to eat with any method, right? In those cases, I think we need to do a release as soon as possible. Hopefully, those are typically the ones that are found in the hospital and are corrected within the first 2 days of life, right? Right in the hospital when they're born. If uh, that's not the case, I do like to wait about a week to allow the baby to just unwind from the womb, right? So they've been in this position, the fascial lines are all in this position. Um, a week would allow them to kind of unwind, especially if you're incorporating some body work, so craniosacral therapy, craniosacrofacial therapy, chiropractic care, infant massage, just to get the fascial lines opened up.
Mm-hmm.
Then that will also help improve symptoms, because a lot of times as we do body work and we work on those fascial lines, tongue function improves. So the tongue is actually part of the largest fascial line in the body. It's called the deep frontal line, which connects your tongue directly to your diaphragm, around your organs, your hips, your knees, actually to the tip of the toes. There's one piece of fascial line.
Mm-hmm.
So, working on this fascial line and releasing that, we see improvements in tongue function. and vice versa. Doing if the body, if that fascial line is released and we still have this knot underneath the tongue, and we release that tongue, we see that fascial line drop and we see a lot less tension in the body. Um, so doing some body work that first week of life to get the body to kind of like unwind, then doing the release that first, week or first 2 weeks, where if you're having symptoms, I feel it seems like that would be a good timing, but it is so different per baby. So some babies initially in the hospital, because I always ask, like, did you see a lactation consultant in the hospital? And the answer is almost always like, yeah, everything was fine. We were doing so well in the hospital. And a lot of it is because when babies are born, those reflexes are so active and they are firing really well, usually.
Mhm.
And so function looks good. But then you get home and things change, but then you don't have that support, which is why I was, initially I was talking about having that care team, not just relying on hospital lactation, because things change so much that first few weeks of life, but having a resource outside of the hospital, someone that you've met with and you feel comfortable with, that can help you navigate that period of time. Um, they can also help you because feeding changes also after a tongue tie release. So you want someone to help you with that process as well.
Mhm.
Some babies lack some of their birth reflexes, so and they are born with lesser oral function. I definitely see that in premature babies, but also babies that are born earlier than 38 weeks. 30, so the last 2 weeks in utero, the baby's practicing their oral function a lot. They're actually swallowing a lot. So they typically do better at like as soon as they're born. Babies that are born a little bit earlier, they may need a little bit more training. So if oral function is lacking, we'd love to work with our colleagues in the occupational therapy and speech therapy departments to help ones that work with infants and are familiar with oral function and birth
Mhm.
reflexes to help us get those reflexes back, get those nerves firing, and the brain to send signals to those muscles to help improve feeding and function even before a release, so that like our goal is in order to do the release or when we're ready to do the release for the baby to be trying to do these things, but is being held back by that frenum. So when I do a release, the baby's like, okay, well, I wanted to do this, now I can freely do it. But if the nerve is not firing, if that muscle is not trying to move at all, when I do the release, it's still not gonna function because releasing the tissue is not going to fix function. And that's something that I, want to reiterate for the viewers or listeners, that we need to be um, looking at this more holistically than just looking at the tie and doing a release. So if you go to a provider that's not addressing the functional aspect, I want your viewers to or listeners to seek for those care providers on their own, um, and make sure they're addressing that side to be able to get the best or most positive impact from the release.
Right. I think one thing that you touched on is really important because sometimes with some of my patients, there's a hiccup in timing where either they can't afford to go right away to be evaluated or assessed, or they call, they're 3 hours away and then so they go with somebody local who can't see them for another month or so. And so I think what you touched on with the chiropractic work and craniosacral and, body work is really important because those are things that they can implement while awaiting that appointment. is there any, if ties have been confirmed by their pediatrician, is there anything safe that they could do at home that kind of applies to any baby who has a tongue and lip tie, and not, obviously every baby is so different and there's specific unique things that the then doctor would have to come in and tell them and educate them and guide them on. But is there anything else that they could be doing if, let's say, there is a lapse of 3-4 weeks before they can get in to see somebody for a more thorough evaluation?
Yes, I think the most important thing would be getting into a provider that would be checking and supporting function. So that could be a lactation consultant that is knowledgeable in oral ties and oral function, an occupational therapist, a speech therapist, some physical therapists, someone that's going to be working with functional exercises to keep the baby encouraged to function properly, um, despite some of the reflexes integrating. So uh, we want to try and avoid compensations as much as possible while they're waiting to be seen, and also correcting some of the functional deficits that or reflexes that are not there. We want to try and get those working on those. So there's definitely a lot that can be done while we're waiting on a release, because as I mentioned, the release is like one part of like the whole thing. And
Mm-hmm.
typically it's like a small part. The rest of it is all the body work and all the functional exercises that parents need to be working on.
And now, obviously, this whole conversation, we talked a lot about the release. Can you tell a little bit about what that looks like,
Hmm.
what parents can expect kind of going into this appointment, pre release, during it, after release, and kind of the importance of, like you've been touching on, the post release exercises and therapies? Can you give a little insight on those categories?
Absolutely, yes. So the release itself, I think so I would definitely try and look for providers that are um, um, more more knowledgeable in the area, or that have dedicated more education into the releases. Unfortunately, I get a lot of babies from other providers that we need to do a second release because the initial one may not have been a complete release. So it's not just about um, looking at the tissue and cutting what you see, but also looking for a submucosal or the posterior portion of the thigh. Some babies don't exhibit the front, the little wing that you see on the front. As I mentioned before, we were looking at like elevation and lift of the back of the tongue. Um, and if the back of the tongue is not lifting because there is a tether underneath the tissue, that also needs to be addressed. And a lot of times, we're not checking for those. We're just looking at the front portion of the thigh. So I think one of the most important thing with a release is choosing the right provider and making sure
Mm-hmm.
that your release provider is checking for those things and are trained to do that type of release. After that, then there are different tools for the release. There are the traditional scissors and scalpel releases, and there are also lasers. Um, with As far as laser releases, my prefer what I use is a carbon dioxide laser. I believe that that's the best thing on the market. It's the best laser for this type of procedure. And the reason for that is that uh, providers that provide laser releases, um, I think we're in tune to like looking for a laser release, but not all lasers are the same. Most lasers on the market are diode lasers, and these lasers are um, when a provider is using a diode laser, they're not actually using the energy of the laser. It's more using the energy of the laser to heat an instrument tip and then melting the tissue away. So it's kind of like burning the tissue off with like a hot knife, basically.
Like
So there's a
cauterizing it.
lot of heat distribution. Yes, there's a lot of heat distribution to the surrounding tissue, and it can cause a lot of inflammation because of the amount of heat that's being used. And there are also other lasers that use water for cutting. And it's always a little tricky with infants laying on their back to be able to do a release. Obviously, again, provider choice. So there are people that are fantastic with using their water lasers. And they, so I don't want to, it is a good laser. It's just with an infant, it's challenging to do with water. The as far as scissors and scalpels, there's no heme control, there's no blood control. So there tends to be more bleeding and need for cauterization with chemicals, which makes it which can be uncomfortable for the baby. The CO2 laser, the way a CO2 laser works is that we are actually using the energy of the laser. So there's nothing touching the tissue. I'm basically just holding the handpiece and I'm hovering over the tissue, and the energy of the laser penetrates a few cell layers deep, and it excites the water molecules inside the cell to where the water molecules evaporate and the cell burst open. So we are working a few cell layers at a time. So like if you imagine like there are two cell layers, one evaporates, the other one is intact. So there's not as much damage. There's not damage. We're not cutting through the tissue. So there's less of an inflammatory response from the body, because the body sees it as a smaller it's not the body is not alarmed to it as much as other methods. Less heat distribution to surrounding tissues. The laser also works in a dry field, so I'm not worried about water going the wrong tube when baby's laying on their back. It also does block small blood vessels and small lymphatic vessels, so there's less bleeding, almost little to no bleeding when I work. So it leaves a clear field of view for me to see exactly what I'm doing and how much I've released. I can go back and check, versus with a scissor, you only have one shot and then you have to control the bleeding. The blockage of smaller lymphatic vessels is also another way that it helps control inflammation. So it makes it more comfortable for baby post-op, both as far as like less heat use and less inflammation in the area, which also helps with better healing and less scar tissue formation. Again, I think the first thing we need to look at is the experience of the provider. But if you have two providers that have the same amount of experience, the tool can have a slight advantage as far as the outcome of the procedure. I know you also asked about the post-op care. So you also want to go with a provider that has a post-op care regimen, because one of the most important things is not allowing reattachment of the wound site. And we do that through lifting the tissue. So there's not um, a scientific or there's not a researched way for post-op instructions. So each provider has their own post-op instructions. But as far as as long as they have post-care routine, that means that they are, they're doing something to prevent reattachment after the release. I hope that answers the question.
Yeah, absolutely. I guess one more question in there before we kind of wrap up this part of our chat is what can parents expect? The question again is how long is it going to take to heal? And it's so subjective, right? It's so different patient to patient. But can you touch on that a little bit? When parents ask you that question, how long will it take to heal? What is your general guideline of what you respond back?
Yes, so the wounds themselves, so if you have a diamond-shaped wound, meaning that underneath the tongue you see like a diamond-shaped wound, that typically means that the posterior part of the tongue tie was addressed. And those are the ones that take longer to heal. And we want them to take longer to heal because we want to guide the way that frenulum is forming, which is why we do the stretches to prevent things from sticking back together. Typically, it takes about 2.5 to 3 weeks for the tongue wound to heal. Lip and buckles, typically a week, week and a half. And during that time when the wound is open, we require more stretches. So my recommendation is every 4 hours to prevent the wound from sticking back together. Once the wounds have healed after the first 2.5, 3 weeks, then my recommendation is massaging the areas, just like any other surgery you have where massaging would reduce scar tissue. It's the same thing with in the mouth. The massaging can reduce the amount of collagen that your body is building in the area to patch things up. So you get a better looking healing site.
Absolutely, that makes sense. And okay, I lied. One more question with kind of going through that post operative phase. Can you? I think something you said earlier is so important. I do tell parents this too. Is that latching changes once those releases are done, and so with babies, let's say this baby is in the newborn phase, the first month of life, how quote long do you see that it takes for that baby to relearn with the proper team kind of in place helping that? Is that something that they'll relearn in a week or something they'll relearn in a month?
That's such a good question because I guess ask that like all the time. And it really depends on our starting point and where we are function wise going into the procedure, which is why I emphasize that functional works so much because if the baby has good muscle memory already and they're being held back by that frenulum, if they have good oral tone, if their tongue is strong already going into the release, and do you guys have me? I think I lost you for a second.
Yeah, we're okay.
Okay, sorry. Um, so if they are trying to function but are being held back by this frenulum, and I go in and do the release, we see a much quicker turnaround with function than if a baby did not really know what to do with their tongue going into the release. So if the suck is disorganized, like if they're just trying to figure it out, but don't have consistent function, and I do the release, it's even more confusing for them because now they're like, okay, like I had it figured out. Now I don't know what I'm doing with my tongue. So things can get worse. So I always check for uh, a good suck and good oral function. I do a quick functional assessment before the release to make sure that I have like the basic necessities to then hopefully have good outcome. And we've been able to get really good outcomes afterwards. because we're checking the functional aspect before the release. But if your baby doesn't really know what they're doing with their tongue, and we just go in and do the release, those are some of the stories you hear where like the release didn't help, or things got worse, is because the baby didn't know what to do now with their new movement, and it took them a long time to figure things out. There are also babies where they're functioning well, but they have very low tone. So those also take a long time after the release, because they need to, just like with any other muscle group, it takes time to build that tone. So those may be a longer process, but improving each day. So we don't want to see things getting worse. We want things getting better. And that functional aspect and being able to work with providers that are knowledgeable in the area and that are preparing babies well for the release becomes really, really important.
Awesome. Well, we are going to wrap up this part of our conversation, y'all. Part 2, I really want to dive into kind of the older child and adult and how airway impacts us kind of globally, not just in the newborn phase of life. But thank you so much, Dr. Jafari. Is there any kind of special shout out, or where can our community reach you? Give us some details about how they can learn more from you.
Absolutely. So thank you both so much for having me on. It's been such a pleasure, and a great opportunity for me to bring this awareness, hopefully for some people that are expecting or have are struggling currently with breastfeeding. If for reaching out, our website would probably be best place, www.drsamirajafari.com, and that way you can also reach our office. Huge shout out to my team for always being there and supporting me each and every day. And thank you both so much for this conversation.
Absolutely. Thank you. And we'll make sure that Dr. Jafari's information is tagged in the show notes below, so you can make sure that you can go and just click on those and get to where you need to go to learn more from her. And until next time, let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.